helping make your life easier. Moms Every Day.
Good afternoon to you, everyone. Thanks for joining us today for Moms Every Day. We have Dr. Kristen Simpson back with us today from Simpson Dental Associates. Dr. Simpson, good to see you as always.
Thanks, great to be here.
Awesome. All right, so today we're talking about a topic that a lot of moms probably care about. We all know that kids are very active when they're in school. A lot of them are involved in sports, some of them involved in band, and those activities can have an effect on their teeth a lot of times. So first question for you, let's kind of talk about sports drinks, because a lot of kids use those when they're playing sports. So is it better for my child to drink Kool-Aid or Gatorade instead of pop?
Well, you know, that can be a little bit deceiving because you think Gatorade, well, that's better than pop, but it still has sugar in it. So anything that has sugar that's being exposed to the teeth can cause cavities, and also it's changing the pH of your mouth. So the pH of pop is about, a 2 on the scale, where 7 is neutral, and what your mouth should stay at. Pop is about 2, Gatorade's around 3. So it's really not a whole lot better in the big scheme of things. So you want to make sure when they're playing these sports that they're not sipping on the Gatorade throughout the whole practice. Maybe drink it at certain points throughout the practice, and then drink water throughout, if they're sipping a lot on it.
And speaking of kids playing sports, Dr. Simpson, do you suggest that all kids wear a mouth guard when they're playing sports?
It is important to wear a mouth guard. I mean, any sport where either a ball can hit you or another child can hit you, a mouth guard is great to use. It can help prevent against concussions. It can help prevent against soft tissue injuries, so you're not biting your cheeks or things if there is trauma. Of course, it'll help to keep your teeth from hitting together. It can protect your joint. So it is important to wear it. You want to make sure that it's a custom fitted mouthpiece. Normally it'll be on your upper teeth that it fits to. You can get the kind over the counter that you boil and bite on and they form to your teeth, but they're normally not as good as the custom made ones, so it's important to have one that's fitted well to the teeth to get the best support.
All right, Dr. Simpson, we all know sometimes the unavoidable happens and a kid knocks out a tooth when they're playing sports. So as a parent, what should I do if my child knocks out a tooth when they're playing their sport?
Okay, well, if it's a baby tooth, you can just leave the tooth out and then see the dentist as soon as possible, just to make sure that the permanent tooth underneath isn't damaged and there's no other damage around the area. If it's a permanent tooth, actually the best thing to do is try to put it right back in the spot where it came out. So you might want to clean it off a little bit. If it fell in the dirt, maybe rinse it, but don't rinse it too long. Maybe just less than 5 seconds. Rinse it with cold water and then put it right back in the spot and hold it there. If you can't do that and the child's in, too much discomfort to be able to do that, you want to at least store it in either milk or like saline water, or their own saliva, actually. You don't want to store it in just regular water because that'll damage the tissue around it. And it's important to get to the dentist as soon as possible because time is critical there. You want to make sure within an hour you're having something done to treat that tooth if you want to be able to try to have long-term stability with it.
Not all kids play sports. Some of them might be involved in band. They might have chosen to go that direction. So Dr. Simpson, for those kids who may be involved in band, can playing a musical instrument affect your teeth?
Well, if they're playing one of the, brass instruments or wood instruments, they might develop an overbite from playing it, but you'd really have to be playing it multiple hours throughout the day to have that really damage the development too much. So if they're just playing a couple hours here and there, it probably won't, do too much damage. If they want to make sure to keep that mouthpiece clean, though. As we've talked about before, cavities are contagious, so they want to make sure to keep it clean, and if they've had a cold or something, really sterilize that mouthpiece part of it.
Well, Dr. Simpson, all very good advice to keep in mind because we know kids are very active and sometimes they don't really think about their teeth when it comes to sports. So
That's right.
we appreciate your help. Thank you so much.
Sure.
If you at home need more information or you'd like to get in touch with Dr. Simpson, you can head over to WSAZ Mobile or WSAZ.com. Click on the Moms Everyday tab. We'll get you all set up there. Have a great day, everyone.